I guess my history goes back in safety, even before the Institute of Medicine report. When I was a resident in 1985, I was involved in a wrong-sided surgery with our team. And not only did we make that mistake, which caused our patient to have 2 surgical incisions versus 1,
right.
We then, including me, lied to the patient in recovery room for fear of medical malpractice, for fear of losing our license. And I was confident, but the attending surgeon told the patient that under anesthesia, he had discovered the patient had 2 hernias and was able to fix both hernias under 1 surgical procedure, saving him a second day from missing work. And when I was sent to the recovery room to discharge him, feeling I was going to feel the wrath of that medical error, he was all smiles and said to me, "No, today's my lucky day," and told me the story of that he had 2 hernias. And instead of fessing up, I looked at him and said, "Yes, today's your lucky day," and I signed him out. So, and I still live with that case. So I was exposed to medical error in 1985. I then got very interested in the topic, and in being a cardiac anesthesiologist, I probably put in more central lines than anybody within our hospital, because every open heart surgery case got a central line. And I'd always ask our administration in the 90s, how come we don't track my complication rates, my infection rates? I don't know what happens to my patients 3-4 days down after surgery. Why don't we do that? And I was always assured, "Oh, I'm sure you're good. I'm sure you're fine." And then the Institute of Medicine report came out, and it highlighted a lot of these issues. And then, as I like to joke, in the land of the blind, the one-eyed man is king. All of a sudden, my CEO and our leadership said, "Who's that guy in anesthesia that's been talking about this?" And, in 2000, 2002, I pretty much became, one of the team members that started quality and safety and led to the University of Illinois Institute for Patient Safety Excellence. So it was kind of a interesting play. I will say I also spent 4 years at Abbott Labs as a medical director in the hospital products division. In those 4 years, I learned more about quality and safety and cycle compression and Six Sigma than I ever did within the hospital. And so when I come back to the clinical world in 2002, that was very advantageous for me to have that background and start be able to train people on these different tools that other industries had been using.